I'm so glad you were able to join me for this portion of my lecture. So, we've talked a lot about dental anatomy, we've talked about what periodontal disease is and gingivitis. But the big question is, well, how do I prevent me from getting it, but also, or developing it, or how do I help my patients effectively? Well, it's actually as simple as it sounds. It's a really good oral hygiene at home. But what are the proper tools to prevent gingivitis and periodontitis? Well, first of all, having a good and consistent routine. And what do I mean by that? Well, these tools that I'm going to tell you about are to be done. You should be doing these every day, at least twice a day. So we're going to talk about what it takes to really maintain a healthy mouth. So, my recommendation always to my patients is start with a good quality electric toothbrush. Some people have tried to use toothbrushes and don't like the feeling. Well, I always tell patients and family members to give it a good 2 weeks of using an electric toothbrush. And oftentimes they're using on the wrong setting because often these toothbrushes have different settings depending on your mouth, or they're using it just incorrectly, and that's why it's bothering them. But again, if your whole life you've used a manual toothbrush, using an electric toothbrush is going to take a little bit of an adjustment. So everyone asks me this question: which electric toothbrush is best? Well, it's kind of like when you go to buy a car. Depending on what features you want from that car, or the quality of it, or whatever, or you can afford, that's kind of what's going to dictate which type of car you're going to buy. Well, an electric toothbrush is very similar in the sense that not one is better than the other. It's really preference. So some oscillate, and then there's others that use sonic technology. And there's many different brands of toothbrushes for each of these methods. Both come with rechargeable batteries. They're lightweight, easy to use. Some heads are round, some are more square, some pulse. So it just depends on what is good for your mouth. You might have a very, very small mouth. And so you're going to need a toothbrush head that is very small. Some of you may not be able to open very wide because you may have, let's say, TMJ problems where your joint hurts. So you're going to need a smaller toothbrush. Also, most of them pulse anywhere from 48,000 to 72,000 movements per minute. And these are the higher quality toothbrushes, which I always recommend. Don't buy a spin brush because spin brushes, while it can kind of introduce you to how it's going to feel in your mouth, spin brushes are not the type of quality that you're going to get from an electric toothbrush. They all have 2-minute timers for the most part. Many of them have pressure sensitivity gauges where if you're brushing too hard, they will light up or it will notify you through your Bluetooth. And the Bluetooth technology is coming out with all these new toothbrushes now. It's really neat. It monitors your plaque removing skills, your progress, how you're doing. So for you techies out there that really like that, that feature will really come in handy. Which one should you choose? Well, again, it depends on your preference. Many dental offices and many companies, electric toothbrush companies, offer a test drive program, meaning when you go in for your dental appointment, your cleaning appointment, they will have disposable heads that are meant only for you to use during a test drive. So you can take a look at the toothbrush, turn on the different settings for it. The dental hygienist can go over with you how you do it in your own mouth, and you can see how it feels if you like it, especially if you've used electric toothbrushes in the past and just aren't sure which one to get. So your hygienist can assist you with choosing the right one for your mouth. And again, it's based on your mouth, your needs, and which one you like better. How often should you brush? Well, whether you're using a manual toothbrush or an electric toothbrush, ideally every time you eat. Why do I say that? Well, every time we eat or drink, our mouth produces acids, bacteria, and so forth to break down the food. It's part of our digestion process. However, depending on what we're eating, depending on what we're drinking, especially those sugary drinks or those energy drinks, or if we're eating a lot of carbohydrates and things like that, there's going to be a greater chance for us to have cavities and gum inflammation. So if we're brushing and flossing every time we eat, and yes, if you can bring a toothbrush and floss to work, that's fantastic. But if you're cleaning these particles out from in between your teeth and around your teeth, you're not giving the bacteria a chance to do any damage. So, friends, if you cannot brush at work during your lunch hour, that's okay. At least try to rinse your mouth. But at home, you want to brush at least 2 times per day. Never skip brushing before bedtime. I will tell you in my experience, and again, I have 21 years of dental hygiene experience. I have almost 30 years of dental experience being a dental assistant before I was a hygienist. Most patients, when you ask them and they're honest, they skip brushing at bedtime. All you tired moms out there, I sympathize with you. Sometimes we fall asleep right after our kids go to sleep and we don't brush our teeth. Well, I will tell you, the reason why I say never to skip before bedtime, well, all of our mouths naturally dry out between 3 and 6 a.m. in the morning. And that's a natural process. That's why we wake up with a dry mouth and that feeling in our mouth, like it's a desert in our mouth. But if we also, on top of that, have a condition called xerostomia, which is a dry mouth condition, or hyposalivation, that means that now, in addition to naturally being dry, now we've compounded it. We have a really dry mouth. And guess what takes over when we don't have enough saliva? Well, bacteria, toxins, and so forth, because saliva is very, very important in keeping our mouth healthy. So now if we haven't brushed or flossed before we go to bed, all that bacteria is taking over. The bacteria is having a party in your mouth, basically. So we don't want that to happen. Please brush before you go to bed. Angle your toothbrush at a 45-degree angle where the teeth and the gums meet and brush for 2 minutes each time. If you actually, because you think, well, 2 minutes is not that long, but if you actually sit there and time yourself, you're going to be surprised at how fast you brush your teeth. So here's a couple of little diagrams. We want to try to divide our mouth, into 4 separate quadrants. So if you take a look at you can even look at yourself in the mirror while I'm doing this, but you want to spend at least 30 seconds in each quadrant. And you want to brush the outsides of the teeth, and more importantly, even so on the insides. Most of the time when I'm performing a cleaning on a patient, the buildup of their plaque and bacteria is mostly on the insides of the teeth. And then, of course, to reach the back sides of your front teeth, you want to turn your toothbrush vertically, as you see in the upper picture in the middle. If you're using an electric toothbrush, you do not want to go ahead and brush with that. You want to simply angle it 45 degrees to the gum line and let the toothbrush glide it along or guide it along the quadrants and let the toothbrush do the work for you. Those toothbrushes are designed to perform with the right amount of pressure and movement. So if you are going ahead and also using that to brush back and forth, you're defeating the purpose of the electric toothbrush. Let it do its work for you. So many patients hate to floss. There's been a lot of controversy about flossing in recent years, whether or not it does anything or not. What does it do? Well, flossing breaks up the bacteria before it has a chance to go under the gingiva or the gums. It removes food and debris. We know when we eat a piece of meat or something that gets stuck in our teeth, we immediately want to go and get that out because it irritates our mouth. So people who have crowns, which are also called caps, bridges, or implants, all those things attract the plaque, and we want to be able to get under them and in between them and clean them out. What I will tell you about flossing is that when my patients do not do anything and do not floss or use any interdental aid, you'll see the incidence of gum disease go through the roof. And so while flossing is not the only thing we can do, we have to clean between our teeth at least once per day. Patients who have large spaces in their teeth, who have had any kind of gum surgery, and now they have spacing and recession of their gum tissue, they're going to know that when they're seeing this, that they know they have to go in there at least once a day, if not 2 to 3 times a day, and clean in between their teeth. Because even if you don't have any food in between your teeth, you have bacteria, microscopic bacteria that you cannot see. And before that bacteria gets together with the other bacteria, and we know it loves to group together and cause damage to your teeth and gums, before it has a chance to do that, The flossing action or the friction of the floss and the brush breaks up that bacteria and doesn't allow it to group together and form hard tartar. So there's different types of floss. No one floss is better than the other. Again, like your toothbrush, it depends on your mouth and what's better for your mouth. Some people, like this picture shows here, like a thicker floss. Some like a thinner floss. It's called a tape, and this is just a regular size floss. There's yarns there's some that actually look like yarn. There's floss holders, and then there's also, this is called super floss. Now, one caution about the floss holder. I always tell patients, ask me what's better, a floss holder or traditional floss. Well, the problem with the floss holder is while it allows you to get your fingers in there better than with this traditional floss, the problem is these tend to snap in between your teeth, and they can cause damage to the gum tissue. You also can't manipulate them as well and get them into the gum tissue like you can with the regular floss. Now, with that being said, if you cannot do anything but use a floss holder, then by all means use a floss holder. If it's just a matter of not really knowing how to floss properly, well, that's different. So learning, really sitting with your hygienist or your dentist and asking them to teach you how to floss properly is worth its weight in gold. Using this just simply because you don't know how to floss, I would really recommend you learn how to use a traditional floss. And super floss is fantastic. It has a spongy part in the middle that allows you to get into bigger spaces where normally this floss would just do minimal. And then the same thing with the yarns, they also get in between. However, for people who have closer spaces or closer contacts, the super floss is not going to be effective. So the proper way to floss. Well, obviously we know we want to get in between. But how do we floss so that we don't do damage? Well, we want to make sure we actually do a C shape with the floss. So not only is the floss helping your gums, but it's helping in between your teeth. Did you know that cavities often form in between our teeth before they do on the chewing surface? And that's because the plaque, sugar, and bacteria love to creep in between the teeth and settle there, especially in our back teeth. Now, if you notice this diagram, where is the person flossing? They're flossing also behind their last tooth. Why is that? Well, you still have tooth surface back there, and often that plaque loves to hang out between the gum and the last tooth on the back side of that tooth. So every single tooth needs to be flossed. Oftentimes, my patients will have beautiful front teeth, they're flossing well. We get to the back, and that's where periodontal disease often starts. So we want to really make the effort to brush really well in the back. Floss really well in the back. But is flossing the only way? Absolutely not. We live in 2020, the year 2020, where there are many, many different options. We do not just have to stick to one way. Flossing is very effective, but proxy brushes, which is this right here, these are a particular brand that I love. They have different sizes to get in between your teeth. Friends, we do not want to force them in between our teeth. They are meant to glide easily in there. If you're forcing it, then you're doing more damage than good. So you have to find the one that fits the right area of your mouth. Now, you may need to use one size for one area of your mouth and then one size for a smaller size or a bigger size for somewhere else. Again, that's where your hygienist can help you. What's becoming very popular, and I really love these as well, are water picks. Now, the reason why I love water picks is they're very versatile. So a young kid who has braces can do really great things with a water pick and getting everything out of those braces. An older individual who has lots of spaces, that's wonderful for them as well. And anyone who wants to clean in between their teeth better, a water pick is fantastic. Patients love using water picks over flossing. What's also nice is you see there's water in this chamber. Well, you also have the ability to use baking soda mixed with hydrogen peroxide. That if you want to do that, you don't want to just dump that in here. You want to take the hydrogen peroxide and baking soda and really shake it up in a separate bottle or container and then put it in. However, if you use any kind of solution other than water, mouthwash, baking soda, and peroxide, After you are done using this, you need to rinse the line back out with water or you're going to clog it. You can also put a fluoridated mouthwash. We're going to talk about fluoridated mouthwashes. There's a cord here for this one. There's cordless varieties. My girls themselves use the cordless variety. Many people like to do this while they're in the shower because it can be a bit messy. So there's a little bit of a learning curve with the water picks. Don't use them on the highest setting right away. You want to go on a lower setting to get used to it. Now, what about mouthwashes? People love mouthwashes. They love to just get up and swish with a mouthwash. However, mouthwashes are an adjunctive therapy or in addition to your brushing and flossing. They don't replace it at all. You want to be very aware of the fact that many mouthwashes contain a high alcohol content. Some up to 40% of the solution is alcohol. That is going to dry your mouth out, especially for those of you out there who have a dry mouth, who are on medications, who have autoimmune diseases, diabetes. You may be suffering from a dry mouth. So I always recommend, there's so many non-alcohol varieties out there now. Honestly, the only mouthwashes that really benefit your teeth are the fluoride variety. They have the maximum benefit. If it doesn't say fluoride or anti-cavity on the bottle and it doesn't say alcohol free, you should not purchase it. It's the alcohol variety mouthwashes dry the mouth out, they burn the tissue, and they're not as effective as the fluoride. If you're going to use a fluoride mouthwash, there's no problem using it in the morning. I recommend you use it at night because you shouldn't eat or drink for at least 30 minutes after rinsing with a fluoride mouthwash. So while I'm not down on any mouthwash and I don't particularly recommend one brand over another, I do recommend that it has fluoride in it. And fluoride is very, very important in helping to reduce the amount of cavities in your mouth. And also it helps with sensitivity that you may be having. So dental visits, we don't want to undermine the fact that dental visits are very important. You have to visit, you should really make sure you visit your dental office and your dental hygienist for your cleanings at least 2 times per year. You want to have a preventative exam from your dentist and cleanings. Friends, it's so important that you don't go to the dentist when you have an emergency only and see them only for that, because there is so much in the mouth that can be prevented just by getting your exam and your cleanings. And if you have periodontal disease where you've been diagnosed with it, you're going to need to have a cleaning 3 to 4 times a year to limit the amount of bacteria, bad bacteria in the mouth, to help with your oral hygiene regime at home, to help reinforce that, to keep you motivated, but more importantly, to keep your gum tissue healthy. Remember to only take care of the teeth you want to save. I heard that a long time ago, and it really made an impact on me. Who does not want to have a healthy mouth and doesn't want to take care of their teeth? So it's very good advice to heed and to really understand that the more we take care of our teeth, the more we do in preventing periodontal disease.